to the Higher Education Access Board. I'm your host, Tiffanie and joining me today is Steve Sharp.
Hi, I'm Steve Sharp. I'm a K-12 school council coordinator and a middle school counselor in Lancaster County.
Stephen is also the past president of the PA School Counselors Association, currently sits on the board of the American School Counselors Association as well. Today, though, he is here to help me have a discussion, a nice, healthy discussion about mental health awareness. For those who don't know, May is Mental Health Awareness Month, and that has been observed nationally, annually, ever since 1949. Purpose of it is to raise awareness about and education about mental health conditions that exist. Specifically today, we really want to focus on those within the school system, all the mental health issues that exist, that arise. Being mentally and emotionally healthy, as we all know, is just as important as being physically healthy. And the stronger someone is with their mental, physical, and emotional health, I think the more successful students can be as a whole. So if you don't mind, what we'll do is we'll go ahead and we'll get started. If you could just start out by telling us just a little bit about why you think it is that mental health is so important today.
Yeah, as a school counselor, before I started as a school counselor, I actually worked at a hospital, Phil Haven Behavioral Health, I guess it's well spanned Phil Haven, out in Lebanon County. And so, I worked in the emergency room, I worked in, admissions, and, the worst day of someone's life was about 4 or 5 times a day in my work day. You can only hear this story so much where you're like, wow, I wish someone could just helped out sooner, could provide the right supports or resources and knowledge, or connecting them the right ways to avert the crisis that they're in. And then starts to be a question, well, why not me? And that's actually how I found and then fell in love with school counseling.
Okay.
And so as a school counselor, I've been able to do a lot of meaningful work, hopefully not just with my students and their families and the work done in schools, but we also were able to pilot a universal mental health screening on behalf of the state of Pennsylvania, which we've been doing. We're coming up on about 10 years. I think we're year 6 or 7. And then in addition to that, I was actually most recently recognized by the governor in his budget address when he was calling for comprehensive school-based mental health supports for students with roughly a $500 million investment over the next 5 years.
Impressive. Congratulations then for that. And also another thing that I think when we're talking mental health awareness, you were saying that sometimes you see it when it's almost too late or where it's at its particular peak. How long have you actually been doing this as a school counselor? How long have you been a school counselor?
I think this is year 11.
Year 11 for you?
Yeah, so I started when I was 8 years old.
All right. I'm with you on that. What types of issues do you think that the younger students are having, as well as than your older students? So those maybe in the um, up through 8th or 9th grade, and then as well as those students in the high school level.
Yeah, so if we're talking about, there are a lot of different ways we can talk about the ways of hearing. If we look to actually our students' actual voice and what they're saying, one of the best ways of finding this is actually through the Pennsylvania Youth Risk Survey.
Okay.
So the Pennsylvania Youth Risk Survey is where we have a chance to interview our students and they report how they're feeling in areas as far as not just mental health, but also substance abuse, bullying, sexual activity, and the list goes on. What we understand is as much as we were in a mental health crisis now post-pandemic, we were in a mental health crisis well before the pandemic. In addition to that, and really what we've seen is it's dramatically increased. That's why we saw the Surgeon General Admiral Murthy really make a call to action last year as far as declaring that we were in a mental health pandemic for kids right now.
Mm-hmm.
When we talk about the things that we see, without a doubt, from as early as mid elementary school through high school, we're seeing high rates of reports of depression, anxiety, whether it be the student self-reports or parent reports or even teacher reports as far as what they're observing in their students.
Mm-hmm.
That could be either the direct behaviors reporting they are saying they're depressed or anxious, or they're appearing restless or anxious, or reporting things like hopelessness as well. Hopelessness, which we call one is something we say sounds a lot like depression. In addition to that, we can say is also one of the features when we talk about things like suicide risk. In addition to that, nationally, we're talking about rates almost 60% in our young women sometimes are reporting over a 2-week period of time, prolonged feelings of sadness or hopelessness. That's very concerning because as much as we can talk as far as the suicide risk that is present and seems to be increasing, more than that, our children are basically, they're struggling. I mean, even here in the state of Pennsylvania, when we talk about Pennsylvania specific data, Again, using things like the youth risk survey,
Mhm.
we're talking about like students reporting like depression, anxiety rates around like 40%. That means even more likely it's either a student to their left or to the right, or
Mhm.
the student sitting at that desk are reporting that they're feeling depressed or anxious for at least more than 2 weeks at a time throughout a given school year.
So for that student, I don't know if you have this information. So for that student, or for that the teacher or the counselor or even the parent who isn't aware of what the signs of depression look like, could you give us just a few? For maybe the student is not yet ready to share that information. What are some of the signs that they could look for to possibly highlight?
Yeah, and
Um,
there are a lot of great ways. I mean, there are plenty of resources out there, whether it be like youth mental health first aid. There are also some great things just for suicide risk, like QPR, question, persuade, refer. But
mhm.
those basic things are going to be like a child's reporting, um, child or teens reporting things like sadness or like acute prolonged sadness, dysphoria. In addition to that, they might be tearful, crying more frequently or more often. In addition to that, most commonly, like is anger, is agitation, sometimes irritability. It could be things like loss of energy or change of energy. Maybe they're not just like slow and lethargic. Maybe they're just really restless, on edge. Difficulty sleeping is a very clear one where it is something that can both you should probably be partnering with your physician, and it's something that's really treatable and can help to alleviate a lot of these things. So it's difficult either falling or staying asleep, or the quality of sleep. Like they're sleeping, they're horizontal, but it's not really feeling like sleep in the
Mhm.
end. A change of appetite, a significant change of body weight in a short period of time. These are some of the diagnostic features when we talk about things like depression.
Okay. So for um, our listeners, if you have any, share a few facts or a few myths regarding mental health amongst our youth or even adults in general.
There is one fundamental myth that I try and talk to our students about, try and talk about a policy standpoint, and really I think is really one of the important pieces of highlighting the conversation today, and that our students' mental health doesn't exist in that squishy part between their ears. Like student mental health and well-being is a systemic structure. There are multiple different factors and a whole ecology of factors that influence a student's mental health and well-being and supporting it. And it's not just how they feel; it's expressing their feeling. And so there are plenty of different like public health initiatives, like school counselor ratios and staffing, like providing psychoeducational tools, like social emotional learning tools, like you were just talking about before, being aware of the risk factors and doing things like creating like school-wide connectedness pieces so students can connect together. It's not necessarily to be like peer-to-peer therapists, but to have meaningful interactions with each other so that there could be a safe environment that could be less stigma, that there could be less stigma. These are all different things that we can do to provide support for our students
Mhm.
across a system. Also, having comprehensive systems where if our students are in distress, streamline the ways that they're able to access care from a trained clinician. These are also things that the more that we perpetuate the myth that students' mental health is just in a feelings box and or a feeling switch in between their ears that gets turned on or off because they're on their phone too much, because someone said mean things, it's just simply false. There are many comprehensive and complex things that we can do to really promote a student's mental health if we start to recognize and prioritize them.
And then in addition to that, I know just a couple of myths that I've heard. There's a stigma about getting help or reaching out for help and asking. It means you're weak. It means you're not strong. It means um, all of these different things. So sometimes people, when they know that they're struggling or there's an issue, they won't do it because of the stigma that is out there. What can parents do, or what can individuals do who are struggling to help to kind of overcome that and say, hey, you know what? I'm going to go ahead and get some help anyhow.
I mean, the one part is just normalizing. What we understand for adults is that the leading category for disability is major depressive disorder. I mean, without going to a remix here, like the reality is like the prevalence of student mental illness is very clear in the statistics that I was able to just quote through you because they're that prominent and prevalent.
Hmm.
Student mental illness is, but we don't stigmatize students for having the common cold. And
Right.
yet, at the same point, we don't stigmatize our students for having things like vision impairment or hearing impairment, or in addition to that, things like scoliosis. But
Right.
these are things that we structure and screen every school year and provide meaningful connectedness to supports,
Mhm.
coaching, but we don't do this for our students' mental health.
Mhm.
More so when we talk about shifting the conversation when it comes to stigma, we don't stigmatize our students for walking out in a fire drill. We don't stigmatize our students when it comes to things like having things like sprinklers over their heads while they read the books, or in addition to that, as they go between classes, having fire extinguishers on the wall. And the reality is, like, we've had 0 students in Pennsylvania die by fire in schools in
Mhm.
decades. And the reality is that student mental health, if we were actually to be conscientious and invest the same structures and systems for student mental health when it comes to access to highly trained counselors like school counselors and other related services like school psychologists and social workers, we were to provide those educational tools. All of our children know how to stop, drop, and roll. Do they know the warning signs for depression and anxiety and where to get
Mhm.
help for that? Like, these are some things, again, that we have been able to, without stigma and without fear, be able to provide these into the basic understanding that we don't even see them anymore in our daily 180 days throughout the school year. And we
So
can,
do you, not to cut you off, but as you were saying, we don't see that in
yeah.
there. Are there any schools within Pennsylvania that you're aware of that actually do point out what it looks like or what those signs are like or what they should do?
Yeah, so Pennsylvania is, I think, a leader in many ways, but I think what I would love to see is a more consolidated vision. When we understand when it comes to some of the ways that Pennsylvania leads, providing youth voice and empowering our students to talk about mental health and raise awareness for it. Pennsylvania has a national organization called AVINUM. It's actually, I think in like 2014 through SAMHSA, I got like for World Suicide Prevention Day in September, I got a flyer, and the first word on it was from Avidum. So this was from Washington, but I knew Avidum was started in Cocalico School District
Mhm.
after a student died by suicide, and students created this mental health awareness group. And we see that as prevalent
So they
throughout.
want it.
They wanted it, and they knew what it was. It was to provide information on depression awareness and on suicide awareness and where to get help and to spread that message. And we've seen that they've been able to do that across the nation in very helpful and productive ways. We understand here in Pennsylvania, we do have through Act 72, we have standards when it comes to addressing suicide risk. Every school district should have a policy. Every school district should have a procedure. And every school district, probably because it's the model policy for that most school boards have adopted, should be providing some level of education when it comes to depression awareness and suicide risk.
Mhm.
These are all things that we can do. But the reality is, in the same way, things that we could continue to do. We collect data every month and every year when it comes to just us doing our fire drills. What data are we collecting for our student mental health as far as what we're doing to create a system of support around them? We have plenty of different grants to invest in the infrastructure of our schools so that they can have things like sprinklers and fire extinguishers. Are we investing the same in our mental health infrastructure? And the answer is
No.
no. Well, I guess the answer is not yet, or not to the degree we could.
Okay.
We saw things like the ESSER and CARES funding, the school safety grants that are happening here in Pennsylvania as well. They've started to provide money that might be able to be used for school staffing in these areas. And what we've seen is ratios have improved since the pandemic. To the degree that our students need, the answer is no. Like, we understand 1 to 250 really helps to enhance a student's experience when we look to the literature. We
Mhm.
also understand in the staffing crisis, if you look to the literature as well, specifically when it comes to school counseling is like a value add. It's like a little bit of sugar. And what we understand is like having one school counselor, particularly at ratio, improves the overall teacher quality of work by a point, it's like zero point 0.4 per teacher in the end. It increases the quality of your staffing all around.
So just to back up, and I want our listeners to be able to understand some things. Just to kind of start out, just on in general, what are some of the roles of a school counselor, in
Um,
addition to the mental health piece?
yeah, when we talk about school counseling, what's unique about school counseling is this: like, the reality is that school counselors will walk in on the first day of their new job as a school counselor, have some of the highest formal education of all the other educators. Most of our school counselors come in with 60 graduate credit of work specifically focused on the student experience,
Mhm.
whether it be uh, direct student direct student support through counseling and other measures, small group counseling, whether it be data analysis to identify and support either school-wide systems or support individual or small groups of systems that are being left out of the supports the schools have to offer, analyzing that data, designing and implementing programs to support students in measuring their outcomes, having extensive training in both legal and ethical issues to guide the really complex practice when it comes to supporting students on a daily basis. The reality is that's actually more extensive training when it comes to supporting students directly than even our administrators that will hire and evaluate them will have. And so, like school counselors, what makes me different than my work as a mental health counselor before this is like, as a mental health counselor, I would support my individual client through individual interventions and supports. As a school counselor, I create systemic interventions and supports to support all of my students. And that's structurally different than other counseling fields. But what we understand it is as like our clients, our students aren't, again, just feelings on top of necks. Like they are actually grow, thrive, and develop or suffer from the systems that are around us. If we can identify and recognize those, work with those, advocate for our students based off our training experience, that's how we actually create systemic change.
Mhm. So you all have, and I wanted everyone to have an understanding of what school counselors do, because you mentioned the ratio of 1 to 250, and that's the number we're looking for.
Yeah.
What they mean is the ratio of students to counselors. And right now, I know in Pennsylvania we are far
Yeah.
away from that. I don't know. I think the last was like we're like 1 to 3 something.
1 to 350 is about what we're at.
Yeah.
1 to 353 is actually
Yeah.
what I think it is with our most recent report. But with that being said, like what we understand is that's across the state, but we have from one as we knew from the pandemic, like we understood like during the pandemic, some school districts were up and learning virtually, and other school districts, if you just drove 5 miles east or west or north or south, they're wondering if their kids were having food.
Mhm.
And like what we understand is like, unfortunately, our educational systems in Pennsylvania are absolutely drawn by zip code lines,
Mhm.
and so there can be very divergent educational experiences just between one school district to the next, let alone within a school district.
Mhm.
So even though that ratio across the state is 1 to 350, what we understand is really like 1 in 10 school districts across the state, like that ratio is over 1 to 500.
Wow.
When we talk about from a building level, 1 out of 5 school districts have ratios of 1 to 550 or higher, or they have no school counselor at all.
At all. And I was gonna say in some of the work that we do, sometimes there isn't a school counselor there at all. So you have folks kind of like just pitch hitting wherever they can to kind of
And
make up, and it's the students who are suffering through
let's
this.
let's just take a pivot out of this for a second. Let's just say, for instance, that it's more to the traditional understood, like that we are just trying to get kids to college, which is a great initiative. In
Mhm.
addition to that, what we understand is like we have a higher education crisis right now. That students are leaving our higher education system and they're not coming back.
Mhm.
Roughly about over 1.2 million students since the pandemic have dropped out of the higher ed system and not returned. That's saying that the city of Philadelphia is a college dropout right now.
Wow.
And like if we look to like the Pew polls, they did an analysis of like
Mhm.
what are the reasons for dropout. And historically, the number one reason would be finances.
Like,
Yeah.
mhm.
Or difficulty keeping up with the coursework. And
Mhm.
absolutely the number one reason right now is stress. Like our students' mental health is the reason that they aren't able to persist in higher education right now.
And do we think the pandemic really spiked that, or the pandemic just exposed that?
I think yes to both. I think
Okay.
it exposed it because what we understand is a lot of those traditional, there are many different factors I think point to our mental health crisis. I think the reality is first, there was already a mental health crisis, and there's
Mhm.
plenty of compelling data into that. What we understand from our K-12 student standpoint is a lot of different things happen. Is like our students who were most impacted, our particular Black and Brown families, like they had two convergent things. Like they were more often essential workers that would need to continue to work and had to struggle with either providing that direct support for their children or maintaining things like employment and the necessary work that they were doing. Also, what we understand is about many of those essential work is they don't provide the same robust insurance coverage that can help their children to access necessary mental health services all at the same time. And the list goes on and on. And as we understand, like we are absolutely in a K-12 educational staffing crisis right now.
Mhm.
We're also in a behavioral health staffing crisis as well. I've been really fortunate in my K-12 role. Like we've been able to build really meaningful partnerships with local mental health providers like Community Services Group
Mhm.
and be able to really help to facilitate to provide a network of services and care for our students within the walls of our school. But at the same point, like from a clinical perspective as well, it adds efficiency because you have at ratio trained mental health professionals to screen, to coach the families as far as expected outcomes, and then in addition, make sure that those who are accessing are going to understand what they are signing up for, get the most out of their treatment, and the kids that really need the treatment are going to benefit from it. And those who just need some sort of brief intervention, whether it be brief counseling, check-ins, just coaching, or some sort of structural support that can be done through the school system,
Mhm.
that's already taken care of. Because like one of the things when it comes to like being like a mental health clinician is like there's a lot of trust involved, but like the interventions you provide, you're trusting your client to apply them, and you're not sure because they leave your office and you'll see them again in a week to a month.
So how do you know if it's working?
You
You
don't.
don't.
But as a school counselor, I do this really weird thing. First, I stand up. Then I turn the knob to my door. Then I pull my door. And I walk outside my door. And then we can do a lot of different things to figure out if it's really working from there.
And that's why you need those numbers to increase. That's why
Yeah.
we need the ratios to go down. Um,
And again, like school counselors, like our training is to do counseling. Our training is to do things that look a lot like case management. Our trainings are to support both students and their families because we understand our students' families are going to be the best families our students have to support them in the end
mhm.
and work with the education system. But we also need to make sure that we have necessary parties that are highly trained as well, like our school psychologists and our school social workers as well, and the behavioral health supports outside that. The reality is, though, like when we talk about like really, if we're talking about the policy investment, why schools? Because all of our students are required to come to schools and will show up at schools in the end.
Mhm.
And we understand like our pediatricians, like the American Academy of Pediatrics, they recommend screens for things like depression and annual checkups. But we understand like our students don't go to annual checkups in the same degree. They show up at school compulsorily every day.
That is true. So a couple things that you mentioned: stress, depression. Those are really, really high
Yeah.
on the list. For a student who's listening, what are some things they can do to help them de-stress, to help minimize um, the feeling of being overwhelmed? And what are just some basic things that they could do?
Yeah, I think there are a couple different things when we're talking about to our students if they're listening right
Hmm.
now. First is understanding that in an imperfect system, there are a range of different supports available, even if you don't know how to access them, and knowing who are the people to get help from. In this case, your school counselor or other school-based mental health professionals, whether it be a school social worker, psychologist, even a school nurse,
Hmm.
could be great people to access to start the conversations for accessing help.
Hmm.
Also, in addition to that, if you are still confused about that, like there's the National Suicide Lifeline has recently rebranded. It is a great resource to provide immediate high level support, but also to troubleshoot. And that's a really tough number to remember. 988. And that could be a great place for students to access as well. Or I know that text messaging is very popular amongst children these days. So,
Hmm.
like the crisis text line, 741 741, and then hey, start is also a way that you can engage in some of these meaningful conversations. Knowing the warning signs for depression, again, sleep and appetite disturbance, pervasive sad mood, irritability, agitation, change in energy. Understand recognizing that if these are present for a persistent amount of time, so like more than 2 weeks, you should probably be checking in with someone, whether it be your school counselor, whether it be asking your parents to schedule a appointment with your family physician or something like that. And also, again, it's taking time to recognize none of our students internalize the narrative that I have a cold, therefore I am a sad person, a bad person, not trying hard enough, or dumb. And what we understand is that depression and anxiety are illnesses, and that in addition to that, they're treatable illnesses, and they are not to blame.
And I think those are very good key points that you make there. For the counselors, the teachers, if they're overwhelmed, are there resources for them as well?
Yeah, there are plenty of different resources. What I understand is the first and very clear thing is to recognize that we are trying to provide the best experience and near perfect experience for our students as possible in a very imperfect educational
Hmm.
system. And that they are not responsible for the design of this educational system, but are still very important in our students' lives.
Hmm.
And so the first part is absolutely recognizing the lifeguard model. Like, please take care of yourself and your mental health because
Mhm,
that is going to be the thing that's going to make you able bodied enough to save our students, particularly if they're drowning.
mhm,
Recognizing some of the common symptoms of mental health distress that I just kind of listed through, both not just for your students, but for yourselves as well. And understand like we are in a very difficult, high stress position and doing things like accessing EAP,
mhm,
finding coaching, modeling, taking your sick days. These are all things that are okay things to do
mhm,
to make sure like we are here to greet and welcome the next class and help them to achieve as we've done before.
mhm. Absolutely. And then another thing I did want to mention is because there is a shortage um, for those who are out there to assist anyone who's struggling in the mental health field. It's the PA Mental Health Education Loan Program. That's a program that provides awareness, provides awards or funding to students who are completing their internships um, as a school psychologist, counselor, a social worker, or school nurse in a Pennsylvania school entity. And I know you do know some about that as well, but I think and I'm hopeful that students will take advantage of that because the more you have um, qualified, trained um, professionals to help, the better the school systems are, the better the children are, the better the adults are, parents as a whole. We can hopefully help to combat the um, this. It's a we're still in the pandemic with it, right? We can
Yes.
kind of like minimize that. Any tips that you could provide or any additional information? And I know you're involved with this um, as well on what students or what someone who's in an internship or hoping to go into this particular field. Any words for them?
Yeah, absolutely.
Not just to take advantage of this, but just in general.
The first most important thing is I please I welcome you to join this very noble profession and the work because it's very valuable and our students need school counselors, our students need school psychologists and social workers to help them, and particularly the complexity of our education system and all the related systems. Who are going to be those people that can help to point guide or to usher them between to make sure they're getting the equal access that they need?
Mhm,
I absolutely do it. And like we talk about like the PA helps, the one part that like for anyone who's listening who has a family member you think would be really great, the answer is more often than not, things that have been uh, barriers for people to enter our field has been our field service. We want people who have field service experience, who've done the direct work in schools under a trained professional in the very sensitive but vital work. Like, but you're not getting a paycheck, and it's hard
mhm,
because a lot of us are adults doing adulting like things
mhm,
and need some income
mhm,
and like just that level of risk. I mean, again, is antithetical to that lifeguard model. And so
mhm,
I just love the PA House program because I really think it's a chance to really create a systemic shift. Because what we understand again, like in this comprehensive system of supporting students, having a qualified and trained workforce is really one big piece of this.
mhm,
And this is, I think, a tool of equity to make sure that in addition to that, uh, we can have a trained professional system that resembles the students that we're working with on a daily basis. And then in addition to that, we can help people from the communities that need the most support become employed in the communities that
mhm,
need the most support as well.
mhm,
And then most importantly, in addition to that, hopefully can what we understand is that most people that are entering into the school council profession, most of them are coming as teachers. But separate to that, what we understand is that particularly for we're missing a lot of opportunities to areas where people are going into things like clinical social work, mental health, business administration, and stuff like that. But the reality is like there are a lot of complex ways in which we support our students and our students have needs, and to reduce the barriers to access and understand the true breadth and joy that is in school counseling and supporting students directly in these meaningful ways, I think this is just a very valuable tool.
I agree. Before we part, I actually just pulled some stats. I went to the Mental Health Association's website. I thought it
Mhm.
was so. I'm reading these so that folks are again because it's Mental Health Awareness Month. They're aware of what's going on. Also, but maybe there's someone who's listening who wants to go into one of the fields. Maybe they want to be a psychologist or the school counselor or social worker, or school nurse, and to help get into the fight. But I was reading in there, it says 15.8 of youth experienced a major depressive episode in the past year. Nearly 50 million, or 19.8% of American adults experienced a mental illness in 2019. Um, and then 8.1% of children had private insurance that did not cover mental health services, totaling 950,000 youth. So there's a lot of work that still needs to be done because you do want to combat the mental health issues and create more opportunities for access for everyone, and then provide the resources and the tools and encourage them to use that so that they can actually get the help that they need and then to be the support system for those. I'm also big on advocacy. So, what can someone do to advocate for more resources or
Uh,
to really get these numbers down as far as the ratio so that we can get closer to the 1 in 250?
yeah, absolutely. There are a few different things. What we understand is there is funding available right now for LEAs to invest in their staffing. And so, like, going to your school board meeting and asking them to invest not in security doors or in light systems, but perhaps to invest in school based mental health staffing, which is something that we understand through public opinion polling, is something that our students, their families, educators, and community members are all asking for. Like, the answer to that is yes, like, advocate for more school based mental health staffing with your school board. That is something particularly here. In addition to that, I think is to understand, advocate for the role, educate other people as far as the value of these things.
Mhm.
More information can be found at things like schoolcounselor.org, which has plenty of information as far as the role of school counseling, or through paschoolcounselors.org as well. We have plenty of information available in that way. I think also is just taking time to recognize a few different things as far as our students. Our students are absolutely in crisis, but our students at the same time, like, we understand, Morgan Stanley did some great student polling over the pandemic. Like, our students, like, they are resilient. They do feel like
Mhm.
they have the ability to bounce back. Particularly, we should put in the right structured supports. In addition to that, what we understand is, like, our students now more than ever feel more comfortable talking about their mental health with other people. So with those different things, like, we have a chance not just to address a crisis, but I think to reframe the conversation when it comes to student mental health. And it is again that our students need support through the systems that we are investing in so that every student has the opportunity to continue to grow and develop.
Well said. Anything else that you'd like to add before we wrap up?
No, I really celebrate, and again, I think this is a really great example of how, like, our students' mental health is all of our responsibility.
Mhm.
So having a chance to be here in this setting to share this conversation, I think is how we continue to create a pipeline of success for all of our students. So just thank you for having this conversation.
And thank you for joining me today and imparting all of your knowledge on it. Again, it's Mental Health Awareness Month, so it's a perfect month for you to come and join us. You mentioned two websites, School Counselors,
Schoolcounselor.org,
and then the other one was
paschoolcounselors.org.
okay. So that's where a lot of folks can get a lot of good information. For those who want information on PA Helps, which is the PA Mental Health Education Learning Program, they can visit PA's website at pheaa.org. There's going to be tons of information on there for those who are interested and maybe want to see if they qualify.
This week is also Teacher Appreciation Week and Nurses Week, so please thank a teacher and thank a nurse.
Thanks to our teachers, thanks to our nurses. Thanks again to Stephen for joining us here on the Higher Education Access Corner. Again, I'm Tiffany Devan, your host, and we'll see you soon.
Thank you.